So we go down on all fours. We've already demonstrated we know that test is limited. So based off of that test, like I said, global motion, right? Lumbar flexion, lumbar extension. I'm more curious for flexion because that's usually what's limited the most. I don't care as much about rotation and lateral flexion. They don't get a lot of movement in the lumbar spine. So she knows how to do the test, knows how to do that. So is it okay if I roll this up, Jen?
What about her feet?
She's fine.
That doesn't matter.
The feet, like some people that do yoga, they know to like flip them around and push there, but either way, it's not gonna change a lot. So Jen is gonna just drop her belly down. That's okay.
Shauna, just blame it on her.
And we're gonna drop that belly down, and then we ask a couple of things that we want to ask on that test is, do you feel any symptoms when you do that?
Just muscle tension.
Just muscle tension. Muscle tension is still a symptom because when we're dropping it down, it should be over there. Sometimes when it is a disc, it will have some relief. They'll be like, oh, I actually feel some relief or some pressure off. So we already got one positive test in there. So the next one, remember, we're going to give the cue. I'm going to have you tuck this down and then crunch this up. So now she knows how to do it. So we're going to drop back down, and now we want to watch her do it. And Jen has a very guarded motion as she goes through. So go ahead. See how it's kind of slow and it has like a painful arc? We'll see that a lot in the shoulder too. Like when they're going up and it's like, I can get there. So now she's here, and this is where we're gonna wanna be in that palpation standpoint from there. So the way that I palpate is I come right over the top. And I'm gonna come in just like this, and I'm gonna start down low, and I'm gonna find those landmarks again, like we talked about. So the first thing that I find is PSIS. That's gonna line me up over across to the bottom of the sacrum, which is called your S1. So the other landmark that I find is the top of the hips, the iliac crest. That lines me up with L4. So basically, we're going to be checking the supraspinous ligament from the base of S1 all the way up to the top of L1, and then it becomes L1 where the ribs end. So that's how you get those different landmarks. And what we're going to be looking at is this supraspinous ligament. So it runs right on top of the spine. I'm gonna do a backed up thumb and sink in, and I'm trying to feel where I can feel the most tension. And she's pretty tender through there. Is that tender, Jen?
Are you going between the vertebrae? Or
I'm right on top of them, and then I go on top of it to find it, and then the ligament kind of sits down in there. So like when we were doing the nuchal ligament, we kind of go over each one. So I'm gonna go in there and just feel where that tension is. Now the next thing that I'm gonna do is I'm gonna palpate on the erectors. So the erectors are pretty cool. They start down low and they go all the way up. So right along the gutter of the spine is what's called the multifidus. Multifidus goes all the way up to the base of the skull. And basically what I do for landmarks here is I know one thumb width out from S1 all the way up to the top of the cervical spine is multifidus. So that's one thumb width out. Then we find the top of that crest, and that's where the L4 is. This is where the longissimus comes. So now we're multifidus, then another finger length out is longissimus, and then the last one on the outside is iliacostalis. And that one we got to kind of come in from the side. So notice I'm not treating the QLs. The QLs usually spasm up because it's getting overloaded. So then I'll go in there, and she's back up there, and then I get myself in a good position where I'm going to come in and just palpate straight down. We're doing that compression, and we can really get in there and see where we find most of that dysfunction. I'm just feeling where that tissue is not moving good, and she's pretty jammed up right here, right about the L4 longissimus in through there. Then we'll do the same thing on the other side, and I'm just feeling for the tissue, like what's not pushing back on me, that decreased compressibility, and she's pretty jammed up right there too. Good. So one thing that I will do is I'm palpating that, drop markers on it as you go through and you start to feel that. Okay? Questions? So palpation, remember when we're palpating the spine, it's like when we're warming up on the quad, we're gonna do it just with the thumb backed up, because some people ask me about how much pressure to put down on the spine. Very little compared to there. So now what we're gonna do is we're gonna go in here and we're gonna palpate the erectors first. So the first one, like we talked about, was multifidus, about one thumb width out. I'm just gonna sink in and just really feel where that isn't moving great. And that decreased compressibility, and she's really jammed right up here. So she's kind of like in a weird junction between multifidus and longissimus, right about her L2. So we're gonna treat that one on the left. I'm gonna draw a little pen mark so I know. So now our next goal is to get what on it? What we gotta get first? Then what? Then tension. We're gonna slow it down. All right, so this is where the setup's gonna be really good. We already got our spot, so we know where we are. We're gonna drop it down, drop the belly down to start. They're gonna start in a shortened position, and then they're gonna lengthen. What kind of slide is this, Gunnar? Internal slide, there we go. So we're gonna set up, and what we say first is we wanna get the hand lined up, and then the body gets lined up afterwards. So I'm gonna come here, and my thumb is gonna go just inferior to it, about a 1/4 inch down. And then I'm gonna line up my foot. So I want like the middle arch of my foot right along there. This one's gonna go behind in like that warrior position, and I'm gonna go here, and then this is how everything's gonna line up nice and easy. So the first thing that I'm gonna do is I'm gonna get my elbow tucked in right here against my side. Now I'm gonna go in, drop down a little bit more, Jen. I'm gonna go in lock and key, lock that up, and my depth is going to be straight down by dropping my sternum. And these erectors are pretty superficial, so you don't have to crush them. So I'm gonna go straight in, depth, depth, depth. I'm gonna back out 10%, and then my tension is going to be a lean of my knee forward. Right there. She's going to a little bit because she's on the floor and I'm pushing into her. So crunch up for me, Jen. Up, 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 up. And my tension, I'm gonna continue to lean into that. But my hand isn't sliding. It's coming right to me because it's internal slide. So I'm gonna do one with my thumb backed up so you can see it.
You're talking about the accommodation of your elbow too. That's where you're moving with them.
Yeah, so my elbow is kind of dropping as she's coming into that motion. I'm leaning and I'm dropping my body a little bit more to account for that curve of that spine as we go. So this one will be without my, remember we don't really want to have the thumbs out in space, but if we have to, we can. So we're gonna get that depth straight in, back out about 10%, and then my tension is in here, and go ahead. And that pulls right away. What are you feeling there, Jen? Just some tension?
Yeah,
And I'm
it
always,
gets worse as I keep going.
and I'm always checking in with the client, like, what do you feel? We're gonna get one more. This one I'll do backed up. So I'm here, body's lined up, elbows tucked. Here, over top, and sometimes they'll be stuck in a little bit too much flexion, so drop their belly down a little bit. There we go. And that'll allow me to get some more depth on it. Back out, tension, and go ahead. And as she's coming up, see how I drop this elbow down? And I'm
And
here.
you want to instruct them to do that slowly.
Very slowly, yeah. Very good, thank you.